Let's discuss face reading heart disease. Heart disease is an umbrella term that includes such conditions as rheumatic heart disease, congenital heart disease, hypertension, heart disease, coronary heart disease, and myocarditis. Common symptoms are palpitation, shortness of breath, coughing, coughing up blood, chest pain, edema, and abnormally little urination. There are two causes. The first is congenital, including heart defects developed while a fetus and pathogenic changes leading to changes in the tissues of the heart. The other is secondary, in which the heart has developed pathogens due to external impact or factors of internal mechanisms. Face reading. When the tip of the nose turns purple-blue or suddenly swells up, it indicates congenital heart disease. When the outer canthus of the eye has a large curved blood vessel that is dark in color, it indicates arrhythmia. So this is the illustration. The tip of the nose turns purple-blue and the outer canthus of the eye has curved blood vessels. Therapeutic methods. Patients with heart disease should take good care of their health on a day-to-day basis to protect and nourish their heart through proper diet, exercise, lifestyle, and balanced emotions. Dietary advice: eat food rich in dietary fiber to reduce the generation of cholesterol, eat green leafy vegetables, and supplement vitamins to promote blood circulation. Supplement with microelements, lotus seeds, which contain lecithin, that fights arrhythmia, can be eaten often by patients suffering from heart disease. Exercise. Appropriate exercise can work to the benefit of your body and enhance your physical fitness. Choose low-intensity exercises. Do not strain and put your body at risk. Emotional adjustment. Maintain a regular schedule. Cultivate a wide range of hobbies. Get adequate amount of sleep and maintain balanced emotion. Keep your anxiety in check and prevent depression. Medicinal diet therapy. Lotus seeds, lily bulbs, and lean pork stew. Lotus seeds and lily bulbs, 10 grams each. Lean pork, 200 grams, and salt. Wash the lotus seed and lily bulbs, add appropriate amount of water, and cook for about 30 minutes. Wash the lean pork and cut into cubes. Add it into the pot and cook until well done and add salt to taste. This soup can replenish the heart, calm the mind, and protect the heart. Massage. Use your thumb to press the knee 1 point for 3 minutes, 1 to 3 times a day. This is helpful in relieving the chest tightness and pericardial discomfort and in regulating the heart rate. Massaging your chest and patting the zone related to the heart is effective to some extent in eliminating chest tightness and pain. Thank you for your attention.
Interviewing still on painful menstrual periods. Liver chi stagnation, there is abdominal distension and pain before or during the periods. Premenstrual tension, distension of breasts, no clots, hypochondrial or epigastric distension, irritability, moodiness, wiry pulse. Acupuncture points, GB34, liver 3, and RAN6. For liver blood stasis, there is severe period pain that is alleviated by the passage of clots, hypochondrial pain, abdominal pain, dark complexion, purple tongue, wiry pulse. Acupuncture points, Chiang Mai, by opening the spleen 4 with P6. Liver 3, kidney 14, spleen 10, REN 6. For stagnation of cold in the uterus, there is severe spastic, cramp-like menstrual pain that is alleviated by the application of heat, small stringy clots on bright red blood, feeling cold during the period, pale tongue, deep tight pulse. Acupuncture points, we open the Chiang Mai using spleen 4 with pericardium 6. Liver 3, kidney 14, spleen 10, REN 6, REN 4, moxa. Damp it in the uterus, there's painful periods with a feeling of heaviness extending to the sacrum, mid-cycle pain, small red clots, excessive vaginal discharge, dark urine, red tongue with sticky yellow coating, slippery rapid pulse. For stagnant liver chi turning to liver fire, painful periods, heavy periods, irritability, thirst, bitter taste, dry stools, red tongue with redder sides and yellow coating, rapid wiry pulse. Deficiency of qi and blood, dull menstrual pain towards the end of or after the period, pain relieved by pressure, scanty periods, poor appetite, loose stools, weak voice, palpitations, tiredness, blurred vision, dull pale complexion, dizziness, pale tongue, weak or choppy pulse. For spleen yang and liver blood deficiency, dull period pain during or after the period, scanty bleeding, no clots, dull headache, blurred vision, tiredness, loose stools, pale and swollen tongue, choppy or fine pulse. Liver and kidney deficiency, dull period pain during or after the period, scanty period, backache, dizziness, tinnitus, night sweating, tongue without coating, floating, empty pulse. So for pathology and patterns of painful periods, for abdominal distension and pain before or during periods, the tongue would be normal with slightly red sides. Pattern is liver qi stagnation. Severe period pain that is alleviated by the passage of clots, tongue with a purple sides. Pattern, liver blood stasis. Severe spastic cramp-like menstrual pain that is alleviated by the application of heat, small stringy clots on bright red blood. Feeling cold during the period, tongue is pale. Pattern, stagnation of cold. Painful periods with a feeling of heaviness extending to the sacrum, mid-cycle pain, small red clots. Tongue is red with sticky yellow coating. Pattern is damp heat. Painful periods, heavy periods, irritability, thirst, bitter taste, tongue with red sides. Pattern, stagnant liver qi turning to liver fire. For dull menstrual pain towards the end of or after the period, pain relieved by pressure, scanty periods, the tongue is pale. Pattern, deficiency of qi and blood. Dull period pain during or after the period, scanty bleeding, no clots. Tongue is pale and slightly swollen on the sides. Pattern, spleen yang, and liver blood deficiency. For dull period pain during or after the period, scanty period, backache, dizziness, tinnitus, night sweating, tongue will have no coating. Pattern is liver and kidney deficiency. Thank you for your attention.
Let's discuss hand tie-in lung meridian with acupoint Chin 2 or lung 8, the meridian gutter. Lung 8 is located on the anterolateral aspect of the forearm within the radial styloid process and the radial artery, one tune superior to the palmar wrist crease. This point is the metal point, the horary point of the lung meridian, which is on between 3 to 5 a.m. It is also the Jing River point of the lung meridian. The role of the receiver of qi is to inspire the heavenly qi that invigorates and infuses body, mind, and spirit with both spirit and qi. To benefit fully from this, our qi needs to be clear and fresh and not stagnant or too hot or too dry. Otherwise, less than clear qi is infused into our entire system. This can lead to agitation, anxiety that there will not be enough harvest to get us through the winter, or a refusal to contemplate anything new because we are jaded and detritus. We're jaded with detritus. Nothing fresh can reach or rejuvenate our outlook, so life continually falls short of our ideals and disappoints us. As a metal point on the lung meridian, the meridian gutter carries the essence of the lung and metal element. The cleansing quality of this point protects the receiver of qi from contamination and allows calm inspiration and wise judgment to prevail. Meridian gutter clears away stagnation, purifies the body, mind, and spirit of poisons, and invigorates and enlivens the receiver of qi. Good for negativity at the level of the mind and spirit, when the punishing aspect of metal prevails over its protective canopy role. Reinvigorating metal's responsibility for the automated rhythmic processes of life and for descending the qi can help clear a body blocked by constipation, mucus, or skin that is lifeless and in poor condition. Flowing gutter acts to sluice clear the gutters of the body. mind, and spirit from accumulated debris, sometimes clearing it from inside to the surface, so the toxins become visible on the skin before clearing completely. Meridian gutter engenders a fresh outlook in life, renewed vitality and enthusiasm. For the fullest response to this point, use at orary time in autumn. It is frequently used in the autumn, the season associated with metal, for many patients where cleansing is an issue. Jing river points are where the qi of the meridian is wider and deeper. Qi is flowing like a strong current at this point. The Su Wen says that qi unblocked and blood at river Jing points move and do not dwell. At these points, exterior pathogenic factors are diverted towards joints, bones, and tendons. Thus, Nanqing indicates Jing river points for cough and hot and cold sensations. Hence, Jing river points are often used for upper respiratory disharmonies and pain in the sinews and bones. Lung 8 tonifies and regulates the lung qi. Its indications are the following: disappointment, cynicism, loss of a sense of value in life, irregular distribution of heat and cold on the body, especially hands, toxicity, upper jaw pain, fever and chills, and wrist pain. As a meridian gutter, this point clears and carries away garbage and poisons. It can clear stagnation and negativity from the body and mind, particularly where there is cynicism present or a feeling that there is no quality or value in life. As the metal point, it shakes up and cleanses the official, especially when used in autumn. Consider when heat or extreme cold are out of proportion on the body surface, especially the hands, the palms hot, dry, or wet. Beneficial for many lung and throat disorders, sudden cardiac pain, intermittent fever, excessive mucus, or wrist pain. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, nausea and vomiting. Duodenal ulcer, anorexia, nausea, vomiting, heartburn, GI bleeding. Functional dyspepsia, psychotropic drug use, anorexia, nausea. Irritable bowel syndrome, psychotropic drug use, anorexia, nausea, weight loss, vomiting. Gastric ulcer, anorexia, nausea, vomiting, weight loss. Esophagitis and reflux without esophagitis, heartburn, anorexia, psychotropic drug use. Gallstone disease, weight loss, psychotropic drug use, anorexia, nausea. Gastric cancer, there is weight loss, vomiting, nausea, GI bleeding, psychotropic drug use. Alcohol-related dyspepsia, vomiting, anorexia, nausea, GI bleeding, weight loss. Significant indicators for this disease pattern, those with asterisks. Other possible causes, diverticular disease, Crohn's disease, colon cancer, pancreatitis, drugs, the NSAID, opiates, antibiotics, hormone preparations, chemotherapeutic agents. Confusion may arise with diagnosis of early pregnancy-related nausea and vomiting. Confusion may also arise in prodrome phase of hepatitis prior to the appearance of jaundice. Key points in differential diagnosis of anorexia, nausea, and vomiting with abdominal pain. Peptic ulcer is the commonest single cause. Over 90% of patients with duodenal ulcer are infected with H. pylori. Functional dyspepsia, gastroesophageal reflux, irritable bowel syndrome account for about half of the cases. Functional dyspepsia is characterized by frequent visits to doctors for non-gastrointestinal conditions, ingestion of psychotropic drugs, and negative H. pylori status. Diagnostic questioning according to number 1, organic interrelationships, primarily liver and stomach, the Kess cycle. Number 2 is nausea from stomach qi ascending counterflow. Stomach deficiency in cold, heat, dampness, phlegm, food stagnation in stomach. Number 3, vomiting, clear water, spleen, stomach, empty, cold, phlegm, food stagnation, worms. With copious, clear phlegm, there is cold phlegm pattern, example, malaria. Vomiting long after eating or exposure to cold, stomach full or empty cold, excessive cold, raw food, external pathogen, immediately vomiting of food or at the sight of food, spleen, stomach heat or heat invading stomach. Periodic nausea and vomiting of clear phlegm, there is phlegm ascending counterflow. With fullness and oppression in stomach duct, food accumulation, dietary irregularities, emotions, or external pathogen. With distension and fullness in the chest and diaphragm, chi deficiency, vomiting from emotional disturbance. Bitter vomitus, that is liver, gallbladder, fire obstructing or being obstructed by damp heat. Sour vomitus, food stagnation, phlegm, fire, liver, chi invading stomach, spleen, stomach, chi deficiency, immediate vomiting of water, deep lying phlegm. Number 4, in pregnancy, disharmony of Chong with differentiation as above. Kidney 27, kidney 21, kidney 6 with stomach 30 for persistent pregnancy nausea. Number 5, Sangpu patterns, stomach, heart, fire. Stomach full of empty cold, stomach yin deficiency, liver chi invading the stomach, food stagnation in stomach. Thank you for your attention.
Let us now talk about the relationship of qi and body fluids. The actions of qi on body fluids are quite similar to those of qi on blood. First is promoting fluid production. The movement of qi provides the generative power for the production of fluids. Body fluids derive from essential qi of drink and food transformed by the spleen and stomach. Their formation and distribution are closely related to the spleen, the stomach, and the small intestine. If qi of the involved Zangfu viscera is plentiful, body fluids will be plentiful. Conversely, they will be insufficient. Second is powering fluid movement. The distribution and excretion of body fluids depend on qi's movements of ascending, descending, exiting, and entering. The metabolism and distribution of body fluids and the excretion of sweat and urine all depend upon the coordinated actions of the lung, the spleen, the kidney, and other organs. If qi moves, so do body fluids. If the ascending, descending, entering, or exiting of qi is impeded, then the distribution or excretion of fluids is also disturbed. This may lead to water retention, phlegm accumulation, or dampness obstruction, the result from the stagnation of water. Third is stabilizing fluid movement. Qi regulates and controls the movement and excretion of fluids and prevents their excessive loss. For example, defensive qi controls the opening and closing of pores and helps to prevent damage to body fluids from excessive sweating. Kidney qi causes the fluid stored in the bladder to be transformed by metabolism into urine and its discharge. Deficiency of qi can lead to spontaneous sweating. Deficiency of kidney qi can lead to frequent urination, polyuria, enuresis, and incontinence of urine. Now let us look at the action of body fluids on qi. Like blood, body fluids are a carrier for qi, and qi must be attached to fluid to act. If body fluids are depleted, for example by diaphoresis, polyuria, vomiting, or diarrhea, qi loses its attachment and may scatter. This gives rise to qi collapse following heavy loss of body fluid. The relationship between blood and body fluid is that they both belong to yin, and both act to nourish and moisten. They supplement each other in physiology and affect each other in pathology. Since they both derive from the essence of drink and food, body fluid and blood share the same source. When infused into a blood vessel, body fluid becomes a component of blood. Some components of blood may also seep out of the vessels and become part of body fluids. Under abnormal conditions, when there is massive loss of blood, body fluid enters the vessels to make up for the volume of blood. This in turn leads to insufficiency of body fluid and such symptoms as thirst, oliguria, and dehydrated skin. Conversely, if there's massive loss of body fluid, some components of blood can come out of the vessels resulting in insufficiency of blood. The internal classic states, those who have lost much blood do not sweat. Those who have sweated profusely lack blood. This is the practical application in clinical practice of the theory that body fluid and blood share the same source. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zhang-Fu organ patterns with the pattern heat blocking the pericardium. Pericardium and Sanjiao imbalances. There is often no description of Sanjiao patterns of imbalance in textbooks, apart from in those that use the diagnostic model diagnosis according to Sanjiao. The only pericardium pattern of imbalance that is usually discussed is pericardium heat in the diagnostic models, diagnosis according to the 4 levels, and diagnosis according to Sanjiao. This is because most authors consider the pericardium and heart to be very closely integrated, so they only differentiate heart imbalance patterns. Machocha in 2005 lists 6 specific pericardium patterns of imbalance, one of which is the aforementioned pericardium heat. Machocha argues that if there are symptoms and signs that can be related to the pericardium channel and its connections and the relationship with the chest, that is the lung channel and the breath channel, not only to heart organ symptoms and signs, we should diagnose a pericardium pattern of imbalance. Now let's go to heat blocking the pericardium. This is not something that we would normally meet in an ordinary clinical setting. When heat has penetrated down to this level, the patient will usually be treated with Western medicine and will probably be hospitalized. If the body is invaded by exogenous heat, the heat will initially affect the Wei level of the Qi level. In some cases, pathogenic heat can penetrate to the Yin level. The Yin level is the superficial aspect of blood. When the disease has penetrated this far down to the Yin level, it is deeper and more serious than when the disease was at the Qi level. Pathogenic heat can penetrate to the Yin level if pathogenic Qi is sufficiently virulent or if it is treated incorrectly or inadequately. Furthermore, pathogenic Qi can penetrate directly from the Wei level to the Yin level because the lung and pericardium both have their residence in the upper jaw. Pathogenic Qi will therefore be able to transmit directly from the lung Wei Qi for pericardium Yin Qi. Yin Qi is the Qi aspect of blood. Blood heat will agitate the Shen, which has its residence in the heart. This will result in restlessness and insomnia. The heat can be so intense that it creates phlegm. The phlegm and the heat will block and agitate the Shen, so the person may be delirious or raving, or they may lose consciousness. The heat will also injure Yin. This is why the tongue lacks coating, the pulse is fine, and the symptoms are worse at night. There can be a rash or PTK because the heat has agitated blood, rupturing the walls of the vessels. Normally, the hands and feet would feel hot when there is so much heat present. This is not the case in this pattern, as the extremities are cold because pathogenic heat blocks the body's physiological heat from reaching the extremities. This is cold true heat, false cold. Even though there is intense heat, there is no thirst. This is because the heat is so intense that it forces fluids upwards in the body to the mouth. Now let's go to its etiology. This pattern will be due to an invasion of exogenous pathogenic Qi. For the symptoms and signs, there will be high fever that is worse at night, insomnia, mental and physical restlessness, no thirst, petechiae, red or purple skin rashes as in erythema and purpura, delirium and consciousness or coma. The skin feels hot when palpated, cold hands and feet, dark red, dry tongue without coating, rapid and fine pulse. The key symptoms, dry mouth and no thirst, high fever but cold hands, and consciousness, red tongue without coating. Treatment principle, drain heat from the pericardium. For the acupuncture points, we choose from pericardium 3, pericardium 8, pericardium 9, spleen 10, bladder 40, LI 11, do 14, and do 26. For the needle technique, we use draining and we bleed pericardium 3, pericardium 9, bladder 40, and do 14. For the explanation on the choice of points, pericardium 3, pericardium 8, and pericardium 9 drain heat from the pericardium. Bladder 40, LI 11, do 14, and spleen 10 drain blood heat. Do 26 revives consciousness. A relevant advice. This is an acute pattern, therefore advice regarding diet or lifestyle is not relevant. The patient must be seen by a Western doctor. Heat blocking the pericardium can be caused by wave chi level heat or chi level heat, and in turn, this can result to blood level heat. Thank you for your attention.
Let us now go to abnormal metabolism of body fluids. The topic is insufficiency, impeded distribution, and excretion. Abnormalities of fluid metabolism, whether regional or systemic, can disturb the production, distribution, and excretion of fluids. The main pathological effects are insufficiency of fluids, maldistribution, and retention. The complex process of fluid metabolism require the transforming, ascending, descending, and exiting, entering actions of qi. Only when the transforming actions of qi are vigorous can the production and excretion of fluids be normal. Only when the ascending, descending, and exiting, entering actions of qi are normal can fluids flow, rise and sink harmoniously, and their absorption and excretion remain balanced. They also require the harmonious participation of many visceral organs, including the lung, the spleen, the kidney, the liver, the sanjiao, and the bladder. The lungs' dispersing actions and the kidneys' transforming actions are especially important. When the body fluids are insufficient quantitatively, the viscera, the exterior, the orifices all lose their moisture and nourishment. There are two groups of causes. One is damaged by the dryness and the heat pathogenic evils. The other is loss due to profuse sweating, massive blood loss, vomiting or diarrhea, polyuria, or excessive use of drying and warming herbs. Insufficiency of fluids can produce such symptoms as dry throat, chapped lips, thirst, dehydrated skin, and withered hair. In more severe cases, there may be sunken eyes, reduced or absent sweating, oliguria, and constipation. Though the two aspects of distribution and excretion are quite different, their abnormal functioning can induce retention of fluids and formation of phlegm. The transformation of fluids into sweat depends mainly upon the depuration function of the lung. The transformation of fluids into urine for excretion depends mainly upon the transforming action of kidney qi. Hence, disturbances of lung and kidney functions can all lead to retention of fluid within the body, sometimes suffused in the skin to produce edema and sometimes among the organs. In general, impedance of the distribution and excretion of fluids most often lead to blockage by viscid dampness, retention of fluids, or accumulation of phlegm and rheum. Blockage by viscid dampness. This is due principally to the loss of the transporting and transforming functions of the spleen, so that the distribution of fluids is impeded. The retained fluid accumulates and turns viscid. In this form, it easily blocks the movement of qi. This is manifested clinically as chest tightness, nausea, abdominal distension, heaviness in the head and body, stickiness in the mouth without thirst, diarrhea with loose feces, a yellowish face, and edema. Fluid retention. This usually occurs when the functions of the lung, the spleen, and the stomach are compromised. If fluid is not transformed, it remains in the body. If it stays in the skin, it appears as edema, regionally in the head, face, eyelids, the limbs, the abdomen, or the back, or generalized. If it accumulates in the abdominal cavity, it appears as ascites, causing abdominal distension. Accumulation and phlegm and rheum. Both phlegm and rheum result from impairment of visceral functions, hence impedance of fluid metabolism. As a result, the fluids do not transform normally but accumulate as rheum. Gelling turns rheum into phlegm. This can cause a variety of symptoms. When rheum causes illness, it has different names depending on where it accumulates. Rheum in the chest is known as suspended rheum, in the lung as sustained rheum, and in the limbs as overflowing rheum. Phlegm ascends or descends with qi and can reach every place in the body. It can affect different organs and meridians to produce a variety of illnesses and symptoms. For example, phlegm in the lung can cause coughing that is productive of sputum. Phlegm in the heart can cause chest tightness, palpitation of the heart, mental confusion, and delirium. Phlegm in the stomach can cause nausea, vomiting, and discomfort in the epigastrium and abdomen. Phlegm in the meridians, sinews, and bones can cause scrofula, subcutaneous nodules, numbness in the limbs, and sometimes hemiplegia or carbuncles. Phlegm in the head and eyes cause obscuration of the orifices with dizziness or syncope. Phlegm in the throat can cause globius hystericus. Thank you so much for your attention.
Epigastric pain, emotional problems, overexertion, and overwork. Emotional problems have a profound influence on stomach disorders. Anger includes emotional states such as frustration and resentment. It causes either stagnation of liver qi if the anger is suppressed or rising of liver yang if the anger is expressed. In both cases, it leads to the situation described in 5-element terms as wood overacting on earth. If the predominant emotion is outright and expressed anger leading to liver yang rising, as well as liver qi stagnation, it affects the stomach more, preventing stomach qi from descending. This causes epigastric pain, belching, and nausea. If the predominant emotion is repressed frustration and resentment leading to liver qi stagnation, it affects the spleen more, causing diarrhea. The influence of liver qi on the stomach is an extremely frequent cause of stomach patterns. In the case of epigastric pain, the pain stems from the center, but it extends towards the right or left hypochondrial region. Both liver yang rising and liver qi stagnation usually stem from a deficiency of either liver blood or liver yin. Especially in women, they more frequently stem from liver blood deficiency. It is important to differentiate whether the underlying condition is liver blood or liver yin deficiency, as the herbal therapy is quite different in each case, nourishing blood in the former case and nourishing yin in the latter. Pensiveness and worry. These affect the spleen, stomach, and lungs. In the case of the stomach, they cause stagnation of qi and retention of food. Physical overexertion weakens the stomach and spleen and may lead to a dull epigastric pain, tiredness, and weak muscles. It usually causes stomach qi deficiency. Mental overwork, working long hours, and eating irregularly over several years cause deficiency of stomach yin. This can manifest with cracks. After many years, the tongue will lose its coating entirely. An inherited constitutional weakness of the stomach is obviously a potential cause of stomach disorders. Such an inherited weakness manifests with a digestive problem in early childhood, such as poor appetite, vomiting, or diarrhea, and possibly also with weak and flabby muscles, low energy, and a crack. So here we have the example of a tongue that will manifest with many cracks as a result of overexertion or too much work. When used strongly, Chinese herbs can injure the stomach and spleen, and excessive or wrong use of bitter cold or moving downward herbs can injure stomach qi or stomach yin and lead to epigastric pain. Of course, the side effects of very many Western drugs are also a frequent cause of epigastric pain. Anti-inflammatory agents used for rheumatoid arthritis are a particular case in point. Thank you for your attention.